Greetings. Today we'll be talking with Justin White, an assistant professor at the UCSF Philip R. Lee Institute for Health Policy Studies, and we'll be talking about behavioral economics. Justin, welcome.
Thanks, it's great to be here.
First questions first. What is behavioral economics, and where did it originate?
Behavioral economics is a relatively new field of study, and it's a combination of psychology and economics. It's in attempts to try to use human psychology to try to help people improve their behavior, drawing on ideas and models from economics. At its root, it's really trying to help people make choices that are in their own best interests. Now, in terms of where it came from, it's relatively new, but it's been around some of these ideas have been around for a long time. Many people say that Adam Smith, who was the founder of modern economics, is actually the first behavioral economist. He had lots of ideas like what he referred to as the passions, which involved ideas like greed and anger and self-control, many things that are at the heart of behavioral economics today. He actually brought up in his work many hundreds of years ago. Now, in terms of the modern behavioral economics as its own field, it was really Daniel Kahneman and Amos Tversky who started the field in the 1970s. And they're two psychologists who came up with a theory known as prospect theory, and their paper is the one that launched 1,000 ships, so to speak. And so following their work in the 1970s, there's really been a blossoming of the field and lots of interest in behavioral economics that has grown over time.
And how does behavioral economics differ from traditional microeconomics, the one we learned in Econ 101 back in college?
Right, so let me start with what traditional economics looks like. It's really rooted in the rational choice theory, which assumes that people make choices, behave rationally. And so you can think of it as, for any given decision in your life, what you want to eat for dinner or anything else, you've got this menu of options, and people weigh the costs and benefits of each option and then choose the one that they prefer the most, the one that's going to make them the happiest. And behavioral economics really diverges from that by recognizing that rational choice or decision-making is really a lot more complex. There are lots of ways that we might not behave in our own best interest, that we, for example, might forget what some of our potential options are. We might give in to self-control and choose an option that might not be in our best interest. We might neglect aspects of a decision or really not do any calculations at all. And so behavioral economics is really about what people actually do to make decisions, and it's really focused on the real world as opposed to either mathematical models or about how people behave in a laboratory.
Well, and now I have the opportunity to ask about one of my favorite words that took me a long time to understand, and hoping you can explain. What are heuristics?
Heuristics are the mental shortcuts that we take in our daily lives. And so I mentioned a minute ago that we might not do these calculations in our heads. Instead, we might use heuristics to just approximate what seems like the best option without really deeply considering what might be our preferred choice. And so there are lots of heuristics that we use. Sometimes we rely on what rises to the top of our mind. Sometimes we might just look at what's most available in our environment to make choices, but it's really about these shortcuts that we take.
And when behavioral economists talk about a bias that distorts their thinking, can you give me an example of what a bias might look like?
Sure. There's many of them. An example might be present bias, is one that a lot of my work focuses on and I'm quite fond of thinking about. And so that would be the idea that people really think or overweight what happens to them now versus in the future. For example, you might make some New Year's resolution to say go to the gym. Tomorrow, come January 2nd rolls around, oftentimes you're not going to be at the gym, or at least by February 1st you might not be at the gym because you're really thinking about the displeasure that you might get from working out and ignoring the health benefits that you might get in the future. So that's one example of a bias. It's where people are really not behaving in their own interest. And another name that we use would be a decision error, or more commonly a mistake.
All right. And another one I've heard of is called availability bias. What's that?
So availability bias would be basically where people are thinking about what's, so when they're presented with some decision, they would think about what's going on around them, and basically the one that's most available in their mind is the one that they're going to choose, really ignoring perhaps what might be a better choice. This might apply, for example, to doctors when they're trying to, say, diagnose a patient. They might really think about the last patient who came in with a case that was very similar and not really paying attention to really what the underlying symptoms might be, and trying to sort of think from a step back and think about the entire presentation of a patient.
So this is very interesting. Clearly behavioral economics is another way of thinking, if you don't mind the pun. How well does it work in health? What do we know about how behavioral economics can help us in health?
Sure. There's really been a lot of evidence that's accumulated over the last couple decades, so I certainly can't summarize all of it, but I guess I would point to maybe a few particularly important areas. The first one is known as defaults, or default options, and the best example is organ donations. And so you can think about organ donation. Some countries have, like the US, have a situation where if you want to donate your organs, you go to the DMV and you have to actively opt in. You have to check a box to say, I want to donate my organs. Whereas other countries are a situation where you have to actively opt out if you don't want to donate your organs. And so, for example, if you were presented with an identical form with a checkbox, you'd have to check that box to say, I don't want to donate. And so these two situations actually have dramatically different results. And opt-in countries, where you have to actively opt in, they might have donation rates of 10 or 20%. Whereas opt-out countries, they have almost universal donation rates, where it would be 90% or more. And so there's these really huge effects simply by altering the presentation of words on the page. And there's lots of other examples of default effects. For example, why don't more people participate in Medicaid, which is a program health insurance program or health coverage program targeted to low-income people. A lot of people who are eligible decide not to sign up. And so the question is why? Well, in part because this is an opt-in situation where people have to actually go to the office, complete paperwork. There's lots of barriers to signing up, and it would be a lot easier if we automatically enrolled people or gave people an active choice to enroll or not, and that would have a huge effect on people's participation. And this applies to lots of other things like end-of-life care, vaccinations, diagnostics, etc. So that would be one area I'd talk about, I would think about in terms of an effect that behavioral economics has had. Another would be in terms of reminders. And so you can think of reminding people to take their medication can have a really big impact. Or asking physicians to fill out a checklist before a surgical procedure. Those sorts of reminders can have a really big impact. And at their heart, they're trying to really call attention to important aspects of a decision. And behavioral economics, I think, has been a driving force in that trend. The last thing I would point to is really thinking about how to motivate people to behave well. And a lot of that has to do with incentives and aligning incentives and designing effective incentives. And so behavioral economics has really done a lot in terms of expanding our understanding about how to design effective incentives. So for example, for workplace wellness programs, to get people to behave healthy or participate, I think we've learned a lot from behavioral economics. Likewise, I think we've learned what works and doesn't work with physicians in terms of motivating them to provide high quality care. So I think behavioral economics has really added to a lot of areas, and I think that those applications are expanding by the day, essentially.
So you mentioned defaults as an issue in trying to get people to do something good. Am I right that in New York, when they tried to ban the 2-liter soda bottles, that was also about creating a default, in this case, a smaller bottle? that would be less harmful?
I think that you can certainly think of that regulation as a default, and I think that really calls attention to the fact that defaults need to be sensitive to the context in which they occur, and so they have to be acceptable to the population. And so if you try to pass a default that is not very popular, you might see backlash. And so I think you want to design defaults that are going to promote health, but at the same time are going to also appeal to popular beliefs.
Yeah, that one definitely ran up against some different opinions about how we should encourage healthy eating.
Yeah, definitely.
For some interventions, like stopping smoking, people know the facts. They really want to stop smoking, and yet it's really hard. And I know there's some evidence, some of which you've produced in Thailand, that behavioral economics can do better. So the question is, what makes behavioral economics so powerful that it can accomplish something substantial where traditional approaches of education and persuasion have failed?
Yeah, it's a good question. I think one of the most powerful aspects of behavioral economics actually doesn't have to do with the science, but it's more about the politics, I think, or maybe even the philosophy of behavioral economics, which a lot of it comes down to what's called nudging, which is the idea that you can change the way that a choice is presented, and just by changing the way it's presented without really restricting choice, that can have a big impact on behavior. And that goes back to defaults that I talked about a minute ago. And this is really a notion that appeals to both libertarians who don't want to restrict people's choice, as well as progressives or liberals who are all about making choices that promote the social good. And I think behavioral economics really sort of straddles the two by and actually there's a term for that which is known as libertarian paternalism, which I think really does appeal to a wide set of people. And so I think that's one reason why it's really caught on among policymakers. But there's also the idea, I think, which defaults might be a good example as well, the idea that if you make small changes, that it can have these really big effects. And a lot of times these changes are quite simple. An employer that's already offering some sort of program, it's very simple to offer the way that the incentives are designed within that program. Or, for example, the ACA offers people a range of health insurance options. If we just change how these options are presented to consumers, that can maybe help them really make better choices for themselves. And so the idea that you can make these small tweaks, but really that they can go a long way towards improving people's health and well-being, I think that's really attractive as well. And there's lots of examples. That economists have a saying that there's no such thing as a free lunch, and I think there's by no means is behavioral economics a free lunch, but I think it goes a long way towards making improvements at very low cost.
And I should note from something you said early in your response that it seems to be the way to end the partisan gridlock in Washington, because you can bring together the left and the right. So I'll keep an eye on that one. Let me end with a question of how can our program graduates use behavioral economics, follow behavioral economics, get involved, etc.?
I think for any student who or graduate who's interested in these ideas, the first thing I'd recommend is go out and get a popular psychology book that's about behavioral economics. There's a number of really quick reads that provide a lot of really great information and just a general overview of ideas that I wasn't able to cover today. So examples of that might be Nudge by Richard Thaler and Cass Sunstein, Thinking Fast and Slow by Daniel Kahneman, Predictably Irrational by Dan Ariely. There's a lot of these books out there which I think could be a really valuable introduction. Beyond that, there are a couple of textbooks out there which might provide more information about the health domain specifically. But beyond that, I think there are increasing career opportunities within behavioral economics. There are private sector companies that are offering solutions using behavioral economics. Some of them are consulting organizations. An example is Ideas 42. You can Google that one. Another one is called PickWell, which provides a technological solution or a decision support tool rooted in behavioral economics. There's also a lot of academic research related to behavioral economics that I would be a really nice entree for graduates who want really hands-on experience. But I think the last thing I would point to is that a lot of these ideas can be incorporated in programs and designing policies that are the efforts that are already underway. And I think just by learning about these concepts, graduates would find a lot of opportunities to incorporate these in the activities that they're already doing. And so I would encourage them to get informed and then to really think about how they can apply it to their policy challenges that they're dealing with in their professional lives.
Thank you very much. Very helpful conversation. I hope the students enjoy it as much as I have.
Thank you very much.